can't see my screen. Okay, perfect. All right. So thanks so much for being here this morning. With us today, we have Laura Thompson, who is with Unite Virginia, and she's a community engagement manager there. And she is going to be giving us an update on their new program and how it can affect many of you on the call. After she wraps up, I am going to jump back on to go over some important updates and announcements and changes that we have to our future listening sessions. So be sure to stay on so I can briefly hop back on and go over those with you guys as well. As always, we've been in the Zoom world for a while now. So if you're not speaking, if you could please mute your mic. We do have the chat feature live. So if you do have a question for Laura, if you want to go ahead and ask that in the chat, and we'll make sure that after she presents that she gets to all questions. All right, so I'm going to stop sharing my screen now and I'm going to turn it over to Laura.
Thank you. And thank you all for being here. I really appreciate this opportunity. My name is Laura Thompson, and I am a community engagement manager with Unite Us. Also, we refer to it as Unite Virginia here in the state of Virginia. I've been with the company since December, and prior to joining Unite Us, I spent 9 years working in probation and mental health here in Roanoke in the New River Valley. And then I spent 6 years working at Anthem on the Medicaid side, where I was in provider relations, and then ended as a social determinants of health provider incentive program manager. And I'm very excited because I always say, something like this would have been so beneficial when I was working with clients directly and trying to get them referred to the appropriate services within the community. It would have provided just so much opportunity for following and ensuring that they received help. Just a little bit about my connection with Southwest Virginia is I do live in Roanoke, Virginia, but my family is from Southwest Virginia. My dad is from a place called Pennington Gap near Lee County. He was a gold mine. His dad was a coal miner. He had two options. He could either do coal mining or the military. So he chose the military, which is why we ended up on the East Coast for a bit, and then ended up in Roanoke after he retired. And my mom is from a little town called Glade Spring, Virginia, which is in Washington County. So Southwest Virginia is just, it holds a dear place in my heart. So I'm going to go ahead and start sharing my screen if that's okay. And again, if you have any questions, please don't hesitate to ask either in the chat or come off mute. I know that often as we do the presentation and the demo, it generates a lot of questions as you think about how this could be worked into your workflow process. But our goal is to build a community of partners across Virginia equipped with the tools they need to collaborate across sectors and create a more equitable community. Joining the network is free of cost for community-based organizations and those considered part of the safety net. We are able to do this through a few different ways. One, we did receive the CARES Act funding through the governor and the Virginia Department of Health, partnering for a Healthy Virginia, Virginia Hospital and Healthcare Association, and Department of Social Services. But we also have funders like VMAP, Ballad Health, Kaiser Permanente, and Optima Health. So we're really excited to have the backing of the state, but also that just means that we're going to be able to touch many more lives as we're working through this. So let's see, building our vision. Virginians are easily connected to the right service quickly and efficiently. Service providers can view, coordinate, and collaborate, and outcomes data is tracked. So the outcomes data is so big for us because we want to ensure that individuals receive help. And why is this important? Because that means that we're able to really understand, one, the community that we're serving, but also are we ensuring that we have resources in place? And in Southwest Virginia, we know that there is a lack of resources often in certain rural communities. So this is a high level look at what I'm going to show you with the demo, but why this is important is it really goes down to the foundation of Unite Us. Unite Us is a veteran founded technology company that began in New York City in 2013 after our two co-founders, Dan and Taylor, experienced a lot of hardship coming out of the armed forces. They just saw how difficult it was navigating health and social services. So they decided to use technology to solve a problem. And here we are in 2021, and we're growing every day. But this is the foundation of what they wanted to do. If there's someone who is working with a care manager or case manager and a social determinants of health need is identified, you can use our platform to make a secure referral to a food assistance provider. But they didn't want to stop there because, as we always know, where there's one SDOH need, there's multiple. It's never just one. And we don't want to do slapping a Band-Aid on it. We don't want to say, okay, here's food for this month. We really want the case managers and organizations that are in the network talking and communicating with one another, because we want these clients to get back on their feet. That's the ultimate goal. So if we have a family that's experiencing food insecurity on a monthly basis, is it that someone in the family lost their job? Maybe they don't know about benefits they qualify for. And that's where we step in with our platform and the organizations just like you. And to talk a little bit about privacy and security, Unite Us is HIPAA, FERPA, FIPS, 42 CFR, SOC 2 compliant, and we also have obtained our HITRUST certification. This means that we maintain compliance a few different ways. We do have a consent form built into the platform, so no referral can be made without that consent being in the system. We do have a third-party HIPAA consultant who works with our compliance team, and we do undergo annual penetration testing to prevent hacking, and we regularly undergo security audits for large health systems and government entities. We also have the ability of building out organizations and programs under the sensitive information opportunity, which means if you are someone that provides substance abuse, mental behavioral health, legal, domestic violence assistance, these have organizational and user level permission configurations that are a little bit different than your standard community-based organization. So as we approach going live in Virginia, we are currently 75% in the state. So our goal is to be 100% live by December 31st, and we are almost there. For my region specifically, I launched the greater Roanoke area and far southwest, which we are calling the Appalachian Highlands because it also includes Northeast Tennessee. We went live in these areas June 8th and continue to build these networks up, but we are actually going live in New River Valley and the Lynchburg Southside area on September 21st. So most of the individuals on this call, you're either in New River Valley or Southwest. So we are doing community engagement just like this, where we're reaching out to give information about our platform. And we do community strategy sessions, but also we would love to talk one-on-one with you to do workflow discovery and planning, because we don't want this to be a hindrance. We want it to be a huge helpful tool for your staff. Onboarding, what it looks like is that you would complete a partner registration form. And we ask this of every organization that's onboarding with us. It's kind of twofold, and you'll kind of see that in the demo. One, we do pull that information to build out your organization in the network. So we list all the different programs, criteria, summary, locations, if you have multiple locations and things like that. But the partner registration form is also unique because every organization is asked to complete one. So that means every program, CBO, anything like that, who fills one out knows they're a part of the network. We do not just list resources on our site. This is a care coordination site. So that means that every organization understands that there is accountability factors, but also you know to expect referrals because you're a part of something. We, just like we have gone live in Southwest Virginia since June, this kind of engagement does not end. We hit the ground running every single day with trying to get organizations on board. Once you complete that partner registration form, we do provide you with training. We have a few different options. One is that we have live webinar user, let's see, every Tuesday, I believe it is, that you can register for, and it's with our user experience team. They're kind of the gurus and architects of the network. So you're able to, one, you can take it as many times as you want, but they're really going to do a more in-depth understanding of the platform, kind of show you those little tips and tricks that you can do to make life a little bit easier. We do have a self-paced online training that you can take. And then of course, your community engagement manager, which is myself, we're here to fill in any of the gaps. And even after you go live, we don't go anywhere. We're here for the long haul. What I always love to say is we're the boots on the ground. One of the nice things about Unitas is their community engagement managers. We're not in a different state. We're not even across the state. We're in the localities that we're serving.
And my baby sister is getting married.
Oh my, is there a question? Oh, sorry. But one of the nice things about our community engagement managers is we are in the communities that we serve. And then we also, understand the intricacies that come with each individual community. For one, in Southwest Virginia, it's not the same. The struggles are not the same as what you see in Northern Virginia or even on the East Coast. So we're here to fill in any gaps for you. And again, even after you go live, we don't go anywhere. So I'm going to stop sharing. Are there any questions? All right, I'm going to go ahead and pull up the demo. Can you see my screen?
Yes, we can.
Perfect. So I wanted to start off here. So after you were to sign up for the platform to join, you would be given credentials. They're unique. Every individual user at your organization has their own set of credentials, and you would go in here to log in. But I did want to show you this just real quick. So we have this chat icon right here. And what that means is that we have a team standing by to answer any questions that you may have or to help troubleshoot any issues that you may have, whether it's logging in or even after you get into the system, maybe something doesn't look right. You have access to an IT team that's standing by. So let's say that you have put in your credentials and you're ready to roll. This is a fictitious environment that we're in here. And the organization I'm going to be is Be Well Health Clinic. And I'm going to be someone named Sylvester. So you can see that I've logged in. This is my organization. And you come to this numeric summary of the referrals coming into your organization. So you can see here that 2 new referrals have come in that you need to review. And then this shows how many referrals are currently accepted into your organization. And then you have an organization timeline as well. What I love about Unitas is that there is no data lag or anything where there's a data dump at midnight or anything like that. Everything is time-stamped at the time that that action is taken. So you're able to watch every action as it happens. And you can even see here, date and time listed on everything. I'm going to go here to user settings. At any time, you can update your user settings. You can even upgrade your security settings to do a 2-way authentication. But here is something I love to show, notification preferences. So as a former QMHP, I know that I lived in my car with my clients. We were constantly on the go between appointments, trying to get them to different resources, anything like that. So I would not have had time to live in a system or even check a system every 5 minutes. So what I love about this is that you can set your notification preferences to let you know when different actions have been taken on a client or referral that you have made. And I do see a question in the chat. Can the software interface with each agency's existing software being used for referrals and intakes so there won't be double entry of information in order for the agencies to maintain their current data needs for reporting to our funding sources? So it's kind of, we never say no. We do have integration opportunities, We have a running list of different programs and other, I guess, software that we are being asked about that we add to our IT team's list for them to investigate. We do have EHR capabilities. Like for instance, a lot of the hospitals have either Cerner or Epic. We do integrate with those, and there's a few others. I would have to know specifics. And if it's not one that we can do now, it is something that we could look at in the future as well. Again, these are the notification preferences, and you can be notified, for instance, if someone closes a case that you've referred, or even if the consent has been accepted. So you have full access over how you're going to be notified, so you don't have to live in the system. So we're going to go here and create a new client. I'm going to step you through what it looks like to create a client and make a referral. I'm going to hope that this one is not in there. Must be another country music fan in Unitas. So this actually brings up a really good point right here, is that if you start to create a client record and it sees a similar name or date of birth, it will stop you and inquire, is this a duplicate record? Because again, we do not want to duplicate records or efforts. So in this case, I'm actually going to say, no, different Tim McGraw here. So we're going to go ahead and continue with creating the client. So as you can see here, we do ask for demographic information. It does autofill to undisclosed. Let's say that maybe you're in the last 5 minutes of your time with your client and you just need to make the referral. You can always go back if you don't have time to fill in all of these information slots. It will just autofill to undisclosed, but you can go back and change that. We do ask that they be filled out if the client gives you permission to do so, just because it helps again with that outcomes data. We're going to go ahead and fill this out. And so the client is able to ask, you're able to ask them, how do you want to be contacted? We can do email, phone number, and that phone number can either be called or texted. And if they do not want to provide either, you can print off a copy of the referral to give them. So we're going to create an email. And we're going to say message and notification. We do ask them what is the preferred method of contact in case they give us multiple sources. We'll say email and the best time to contact. We'll say evening. So going down to address, let's say that maybe you have an individual who does not necessarily have a home of their own, but they're kind of staying with friends and it kind of bounces around a little bit. What you would simply do is put unknown here, but you want to make sure to put that zip code right here. And the reason being is because that's what's going to help you help prevent from searching the entire state. We're going to only pull services that are within this zip code. So here we are at the consent form. As you can see here, it is asking for the consent to be completed before you go further with creating the referral. There's a few different ways that we can do it. We do offer, if you want to print off from our site, a signed paper form and just upload it. You can do an audio file. You can do an on-screen consent, signature by email, signature by text message, or an attestation. So I'm going to go here to go to form. So here you can see with attestation. So this was a form that actually helped a lot of our organizations last year when COVID shut down a lot of things and you were not able to do face-to-face. We provide you with the full-on script and questions to ask your client over the phone to ensure that they understand what information is being shared here. And then you would simply sign your name right here, click attest. And then just like that, you have a consent on file. So as you can see here, this is the client case face page, and you can see that you can add care team members here. So let's say that maybe you have 3 different case managers and they all kind of work with this individual. You can add them all right here. So that way they're all able to see the notes and things like that. Down here, you do have a client timeline. Again, it's going to capture everything that's going on with this client. And then here is how you're able to add notes or message the client. So you are able to message the client directly from our platform. As you can see here, They do have an email address, so you can actually send a message directly from here and they will get it. And that goes into the question in the chat, are email messages to clients encrypted? We do have secure, and I can actually include that in the follow-up email that I send. We actually have a full-on security overview that explains how we handle PHI, messaging, and things like that. I do want to point out that you are able to upload different forms such as assessments or anything like that and have them stored here. So we're going to go ahead and refer Tim. And we're going to say that Tim, let's see, we're going to say Unite DMV. And we're going to say that maybe he lost his clothing. He lost a job and he lost his clothing. So you're able to see here that you can do the drop-down box and search all the different organizations that have clothing options, or you can go to Browse Map. I love the Browse Map feature because that's what shows you how you're searching. So again, that whole thing about putting in that zip code, this is what it shows. This circle is that zip code. And if you, oh, I always move too fast. Sorry about that. These little pins are these organizations right here. So you're kind of able to look and see where each of these organizations are, maybe in comparison to where your client is staying at. But I do want to click on this real quick because this is going to go into that partner registration form. So again, we ask every organization to complete a partner registration form. This is the information that we pull from it. We always ask that you complete it out, give us as much detail as possible because that's what we're going to list here. We do a summary, we can add phone numbers, web addresses, hours of operation, different locations that may exist. And here are the different programs. So as you can see here, they have a clothing program. This one has a food program, a legal program, and we always ask that you list the criteria because that's also going to help those searching for services understand who you're serving. So if you have an adults only program, you're going to want to put that information in there that you don't accept clients under the age of 18. But again, showing that you have full control over your organization. See how this has a green check mark and it says accepting referrals. Maybe you have a program like a food bank and it's halfway through the month and you're already depleted. You can go in and actually change this to not accepting referrals at this time, and a red X would come up, and that means that no referral can be made at that time because they know we don't have the resources right now. And then at the beginning of the next month, when you have resources again, you go back in and you check it and change it to accepting referrals, and everything is automatic. Again, full control over your organization. So we're actually going to click Bread for the City. We're going to hit Add Recipient. I do always like to point this out right here. When you're making a referral, you can have documents that are uploaded that go specifically to the organization you're making a referral to. One of the things that I remember most is when I would be working with clients who often received a shutoff notice for their electricity. So an organization that is helping with shutoff notices always need a copy of that shutoff notice because they need to verify the account number, the address, that the account is in the client's name, how much it is. This would be an opportunity for you to scan it and upload it here so that it travels to that organization that's going to help pay for that. With your partner registration form, you are able to ask additional questions just so that you can say, hey, we want more information in our hands before that client even steps foot into our office. But again, it also helps that client not have to retell their story for a third or fourth time. So in this case, this organization is asking, what needs does client present? And we're going to say clothing. And then from there, who is in need of clothing? The client. And what is the purpose of the clothing? So then you hit next. We do ask that you review and make sure all the information is correct. And then you hit submit. And just like that, you have made a referral. This is your dashboard right here. And what that shows is you can see the different buckets under sent. You can see that this includes you can look at closed referrals, open, but again, this right here, you can see that Tim McGraw is up there at the front. That referral was just made. So if you click referrals right here, these are referrals coming into your organization. So we're going to click on this one. And as you can see, it's marked as yellow and says needs action. So you have a few different options. One, you can accept the referral. You can hold for review. Maybe you need additional information. You can reject it. Maybe you're a clothing bank and you received a referral for a food bank. You would reject that back and just let them know, hey, wrong resource here. You can send it on. Maybe you literally in the past 10 minutes are at capacity or bandwidth for accepting referrals for a certain program. You can actually send it on to another program or an organization within the network that you know is open and can accept that referral. Or you can start intake. Maybe you're an organization that has to complete an intake before you can actually accept it. But we're going to go ahead and accept that right here. And we're going to say we're accepting them into mental health clinic. And here is the primary worker. We're going to hit save. And as you can see here, that changes from yellow to green and says open. You can go to that individual's face sheet, kind of look at their information, see how they prefer to be contacted, update, and again, here's their case timeline. Now, let's say it's time to close out that referral. You would simply hit close case. And so there's two different ways. Is it resolved or unresolved? Regardless of how it ends up, even if it's unresolved, we still want to close out that case. It's very important because again, we're looking at that outcomes data. So let's say it is unresolved and it does not count against your organization at all. And part of that is we give explanations on why. So, maybe a client declined services. Maybe they relocated out of the service area. Maybe they just didn't complete the program. Maybe you looked at it a little bit further and they're just not a good fit for your program. Or maybe you were unable to contact them. So you would indicate that right here. So we're going to say client declined services. And just like that, you hit close case. And so that one's been closed. And again, it will take you to those buckets to look at all the cases that have been closed. And again, you can review all these. So we are going to go here. And I do always like showing this because you get two different types of information set. So one is your own organization's information and data. So you're going to have all that data that can be downloaded into a CSV or Excel file, and it's going to include, every single detail, and you'll be able to whittle it down to the most important information you're wanting to capture. And then you get the network level information and data. So I always like this, and this is why I talk about that demographic information. We're really able to kind of look in and see who's being served in our communities. And then this is always my favorite right here. This service episodes by parent service type. So in this specific network, you can see here that benefits navigation make up 6% of the referrals being made. Transportation is 6%, mental behavioral health is 7%, and food assistance is 23%, and employment is 32% of all referrals being made in this network. But if you click on that, you're able to drill down a little bit further. So as you can see for that employment parent service type, 71% of those referrals are actually for career skills development. Job placement and search is for 25%, and job training is for 4%. And you're also able to kind of look and see the health of the network. This gives you that opportunity to see what organizations are in, which organizations are receiving the most referrals. And it also says, hey, who are we missing? And that's where we always come back to the organizations that join the network. Let us know who your trusted partners are in the community, and we'll outreach them and try to get them on into the organization as well, because we want to make sure that you have organizations to make referrals to, but we also want to make sure that we're hitting the resources correctly. So as you can see, the number one resource here is obviously bread for the city, and it's probably for food assistance or clothing assistance. So we want to make sure at Unitas, we kind of look at this and we start going, okay, we need to outreach additional food resources and clothing resources to bulk up our network. We want to make sure that one organization is not getting slammed, but that we have plenty of resources to meet this need, because this must be a prevalent need in this community. I always stress this when I'm talking to our rural health and rural community-based organizations, that again, we go back to that lack of resources, lack of funding. This is an opportunity to use this data to help you. When you go to ask for additional staff, additional resources, or maybe you're writing to RFPs, this is what's going to help you. You're going to be able to tell the story of your community, what's going on, but you're also going to tell your organization's story. This is how we're helping the community, and this is why we need additional resources. So I'm going to pause there to see if there's any questions. I know that was a lot of information, and I would love to meet one-on-one with all the organizations, because that's where we really get down to, you know, what does your organization do? This is how this platform can really help your organization with tracking outcomes, but also ensuring that those in need are actually getting connected to resources in the community. Any questions?
Looks like there's a few that just came in.
Yeah. So the Get Help option. So we do have that opportunity. One of the really nice things that we have in Unite Virginia is what's called Network Hub Support. I call them the guardian angels of the network, because their daily job is literally to watch the network, but it's twofold. One, they are looking at the referrals on a daily basis, watching, making sure that referrals are not getting siloed somewhere, that they're going unattended for long periods of time. Again, that's where the community engagement managers and network hub support really come into play with maintaining that contact with organizations. Like maybe there's been an organization that hasn't responded to referrals in a week. We're able to reach out to them and kind of inquire what's going on. Maybe there's been turnover and they're just slammed. But also the other aspect is people can make referrals for themselves, but what happens is they're not making a referral directly to an organization. The referral goes to our network hub support, and their LCSWs, former caseworkers and managers. And what they do is they end up taking on the role as a case manager for that individual asking for help, and making sure that referral goes through to an organization that's in network, and then they track it to ensure that they get connected to the help that they need. We are open in Southwest Virginia. I'm not sure which site that you're looking. Are you looking on the Virginia?
Yeah, I'm looking at virginia.unitus.com.
Right.
If you click on the For Individuals Get Help.
Right. It is not statewide. That part is not statewide.
Okay.
We do have it just in certain areas where those LCSWs are, but we are trying to bring in more organizations that will agree to work with network hub support in versus, you know, just doing it the regular way, provider to provider. Yeah, that's our goal though. Our goal is to get there. How can we set up a one-on-one? Great. So if Ashley doesn't mind, after this, I will craft an email that will include the partner registration form, my calendar link, which is where you can click and you can find a time that works best with your schedule. And that way, you know, you can go ahead and schedule for a 30-minute one-on-one. I will also include the Unite Virginia overview packet and a couple other things in there. And Ashley, if you wouldn't mind forwarding that on to everyone on the call, we really do love to talk one-on-one with our organizations. That way you have a true understanding of everything as you come onto the network. There are a couple little things. So one, we are live in Roanoke and Southwest Virginia, which means as partner registration forms come in, we are actively building those organizations and they go live about 1 to 2 weeks. We are going live in New River Valley and Lynchburg, Southside area on September 21st. So what that means is as your partner registration form comes in, we build your organization. And then on September 21st, that's when your credentials will go out. But we are also doing a launch party. It's Zoom, of course, it's not in person, which is a bummer, but it's okay. But that's an opportunity for everyone to see who joined the network, get to know those organizations, because again, we want all the organizations really coming together because that's how, we solve problems, is everyone talking to one another. But I will tell you, if you are in the Lynchburg Southside or New River Valley, to participate in the Go Live, we have to have your partner registration form in by Monday, August 30th. So with that being said, like if you want a one-on-one with me, please set it up in that calendar link, but also I will have the partner registration form link in that email as well that I sent to Ashley.
So what I'll do is this call is being recorded, and so we'll add it to our website. And then whatever information that you give me, I'll just create a document that has all that information in there. And so then we'll just kind of send that link back out in our nonprofit newsletter. So not only just the folks who are on this call, but all the nonprofits in our network will have access to.
Thank you. And even after we go live in September, again, we don't stop. That just means we pick up the next day and we start outreaching organizations again, just to give you a little bit of information about that. So June 8th, when we went live in Far Southwest Appalachian Highlands, we had 40 organizations. We are now up to 53 because we have continued that outreach for Far Southwest. Any other questions? Well, thank you all for taking the time to learn more about Unite Virginia, and I'm looking forward to hopefully speaking with you all very soon.
Thank you. And I think one more question came in before we let you hop off.
So you would have an option. There's a couple different options. One, you can do one partner registration form and list those locations, or you can do 3 different partner registration links for those different locations. It would depend on, do you want to make referrals in between your locations? Do you want your data separated by location? So those are things that we can definitely talk about in a one-on-one to figure out what's best for you and your organization with tracking that information. But we can go both ways.
Perfect. Thank you.
Awesome. Thank you.
Well, if you get that over to me, then I'll get that up on the website, hopefully by the end of the day today. So if you guys want to be on the lookout for that, whenever I get that, I'll put it up there as soon as possible. That way, if you guys want to schedule some meetings with Laura, since you have 11 days, if you want to be in there for September, then you have the time to do that. So I'll be happy to do that.
Thank you. It was nice to meet everyone.
You too, and you can hop off. I just have a few announcements I was going to make. You can stay if you want, but we really appreciate you being here and sharing this information with us.
Yeah, thank you. I'm going to hop off so I can go grab that second cup of coffee.
All right, thank you.
Bye.
Bye. All right, I just have a few more things that I wanted to chat with you guys about before I let you get your Thursday going. As I just mentioned, this call and all calls are recorded and we do put them on our website. Our next call is going to be on September 16th and it's going to be on strategic planning. I did want to let you guys know a few things that we're going to be changing with nonprofit listening sessions. We did send out a survey. It's been circulating the last few weeks, just kind of getting you guys comfort levels on if you're ready to meet in person, if you want to stay on Zoom, what you're looking for and topics that we're providing, just to make sure that we're providing you all with information that you find valuable. And so what it looks like so far with the results that we've gotten is that most folks who are comfortable meeting in person liked having that Zoom option. And so we're just going to go ahead and stay on Zoom until the end of this year, and then we'll reevaluate next year. We are going to be moving the start time from 8 a.m. to 9 a.m. We have gotten some feedback that 8 a.m. is a little early for some folks, especially with school getting started back up. That's kind of 8 to 9 a.m. is a prime time for people getting their children to school. But we, still want to know what you guys are looking for from us and what areas that we can be providing you all with trainings and additional information that you find valuable. So if you haven't taken that survey, it's been in all the nonprofit emails that have gone out, and I can send it out again in the next email that goes out as well. But we really do value your opinions and what you guys are looking for in trainings that we can offer. We want to make sure that you're finding the time valuable and that you're getting something out of it. And so we just wanted to let you all know some of those updates in case you're curious if you did take the survey. And I'm going to stop sharing because I think I'm freezing. Does anybody have any comments or questions or anything that you want to add before we hop off?
So Ashley, the next one in September is going to be at 8 o'clock, not 9 o'clock.
So that was a typo. It's going to, starting next month, they're going to be at 9.
Okay.
So September will start 9 a.m.
Okay. Thank you.
You're welcome. Anybody else have any comments? No? Okay. Well, thanks so much for joining this morning, and we hope you found this valuable, and we look forward to seeing you the next time. Bye.